All right. So today we are going to be deep diving into something I think we can all relate to, and that is maximizing your recovery after surgery.
Absolutely.
And more specifically, we're looking at how to reduce swelling and how to speed up that healing process.
Yeah.
And we've got this awesome source here called Post-Surgery Recovery, how to reduce swelling and heal faster. And, there's some seriously surprising and effective tips in here.
It's amazing
Yeah.
what we can do to help our bodies bounce back.
Yeah.
Isn't it?
Yeah.
And it all kind of starts with understanding what's happening beneath the surface
Okay.
when we experience that post-surgery swelling.
Okay, so let's unpack that.
Yeah.
I'll admit, I used to think swelling was like my body's way of protesting the surgery. It's like, hey, what did you do to me?
I love that. That's a pretty relatable way to put it.
Yeah.
But actually swelling, or edema, as it's clinically called,
Okay.
is a sign that your body is already hard at work repairing the damage.
Okay.
It's a natural inflammatory response to trauma.
So it's not the enemy.
Not at all.
Okay.
It's more like a necessary step
Okay.
in the healing process.
Got it.
Think of it this way. Surgery, no matter how routine, creates a sort of controlled injury.
Right.
Your body immediately sends a rush of blood to the area, bringing in all these amazing cells and nutrients that are essential for repair.
Okay.
That influx of blood and fluid is what causes the swelling we see and feel.
Wow. So my body's actually on my team, even if it feels a bit uncomfortable.
Absolutely.
Okay, but this source talks about ways to manage that swelling, right? To help things along a little bit.
Exactly. It's about working with your body's natural healing mechanisms.
Yeah.
Not against them.
Okay.
And this source lays out 10 fantastic tips to do just that.
All right, hit me with them. What's the first step to a smoother recovery?
Okay, well, before we jump into the specifics,
Okay.
it's crucial to emphasize that following your surgeon's post-op instructions is paramount.
Of course, yeah.
Those guidelines are tailored to your specific procedure and are key to avoiding complications.
That makes perfect sense.
Yeah.
We don't want to go rogue and mess things up.
Exactly.
But beyond following the doctor's orders, what are some things we can do on our own to support that healing process?
Here's where it gets really interesting.
Okay.
Cold therapy, for example,
Oh, yeah.
can be a game changer.
I've always wondered, how exactly does cold therapy work to reduce swelling? It's not just about numbing the pain, right?
Right. Applying cold to the area actually constricts the blood vessels,
Oh.
which reduces blood flow and helps minimize inflammation. The source recommends 15 to 20 minutes on, 20 minutes off for optimal results.
So it's like temporarily putting the brakes on that initial rush of blood and fluid.
Precisely. It's a simple but effective way to manage that initial inflammatory response.
Okay.
And then we have elevation,
Okay.
which is all about harnessing the power of gravity.
Okay. I'm intrigued. Explain how gravity helps with post-surgery swelling.
Remember how we talked about fluid retention? Well, by keeping the surgical area elevated,
Okay.
ideally above heart level,
Yeah.
you're essentially encouraging those fluids to drain away from the site.
So if I had surgery on my leg, propping it up on some pillows would make a difference.
Exactly. You're using gravity to your advantage,
Wow.
helping those fluids move back into circulation
Okay.
more efficiently.
So simple, yet so smart.
Yeah.
It's amazing how these basic principles can make a big impact.
Absolutely.
What else is on our recovery checklist?
This one might surprise you. Hydration.
Okay.
And I'm not just talking about sipping water when you're thirsty. We're talking about aiming for a solid 8 to 10 glasses a day.
That does seem like a lot. I never realized how important hydration is for actually reducing swelling.
Yeah.
So besides flushing out toxins, what else is going on at a cellular level when we stay hydrated?
Think of it this way. Our bodies are incredibly complex systems, and they need the right balance of fluids
Okay.
to function optimally. When we're dehydrated, our bodies tend to hold on to water, which can actually worsen swelling.
Oh, wow.
Staying properly hydrated helps maintain that balance and encourages your body to release excess fluids.
That makes so much sense. I always thought drinking too much would make me more swollen, not less.
Yeah.
Okay, hydration check. What else can we do to support our body's natural healing abilities?
Well, what we eat plays a crucial role, too.
Okay.
This source really highlights the power of an anti-inflammatory diet
Okay.
for recovery.
So we're talking about ditching the processed foods and loading up on the good stuff. But what makes certain foods anti-inflammatory? What's the science behind that?
That's a great question. Certain foods contain compounds that actually help reduce inflammation in the body.
Okay.
Think about vibrant leafy greens,
Okay.
like spinach and kale.
Right.
They're packed with antioxidants
Okay.
that help fight inflammation. Then you have delicious berries,
Okay.
like blueberries and raspberries, which are rich in anthocyanins known for their anti-inflammatory effects.
Okay.
And let's not forget the omega-3 fatty acids
Oh, yeah.
found in fatty fish like salmon and tuna. Those are powerful anti-inflammatory agents as well.
Okay, those actually sound appealing.
Hmm.
It's not about depriving yourself. It's
Oh,
about nourishing your body
exactly.
with the nutrients it needs to heal.
Yeah.
And what about supplements? Do those have a place in
Well,
recovery?
it certainly can, but as always, it's crucial
Yeah.
to consult with your doctor first.
Safety first, always good advice. But speaking generally, what kind of supplements might be beneficial during recovery?
Let's start with vitamin C. It's a superstar for collagen production, which is essential for tissue repair.
Okay.
Think of collagen as the building block of our skin tendons and even blood vessels.
So vitamin C is basically helping to rebuild those damaged tissues from the inside out.
Exactly. Then we have bromelain,
Okay.
an enzyme found in pineapple, which has been shown to help reduce inflammation.
Huh, interesting.
And arnica is a popular choice for its anti-inflammatory and pain-relieving properties,
Oh, yeah?
especially for bruising.
I've definitely heard of arnica for bruising, but I didn't know it could help with post-surgical swelling too.
It can be quite effective.
Wow.
And finally, zinc plays a key role in wound healing and supports a healthy immune system.
Okay, so we've got cold therapy, elevation hydration, a power-packed anti-inflammatory diet, all working together to support healing.
Mm-hmm.
What else can we do to boost our recovery?
Believe it or not, gentle movement is key.
Wait, really? I thought rest was the most important thing after surgery.
Hmm.
Tell me more about the role of movement in recovery.
Rest is definitely important, but gentle movement, like short walks as tolerated,
Okay.
actually helps improve circulation and prevents blood clots.
Okay.
Improved circulation means more of those healing nutrients are reaching the surgical site.
Right.
Of course, always follow your surgeon's guidance on when to start and what type of movement is appropriate.
So it's about finding that balance between rest and gentle activity. Makes sense. No, I've heard of compression garments. How do those factor into the recovery process?
Compression garments can be incredibly helpful for managing swelling and improving circulation as well. They gently squeeze the area, which helps reduce fluid buildup and encourages blood flow.
Right.
They're especially useful after certain types of surgeries, but again, your doctor will advise you on whether they're right for your situation.
Okay, so we've covered a lot here. Cold therapy, elevation, hydration, anti-inflammatory foods, supplements, gentle movement, and compression garments. Am I missing anything?
Let's not forget about the importance of sleep.
Oh, right, sleep.
Quality sleep is absolutely essential.
Yeah.
For the body to repair and rebuild, aim for 7 to 9 hours per night and make sure your bedroom is a haven for restful sleep. Cool, dark, and quiet.
The sleep sanctuary, can't argue with that. And I have to ask, what about those alternative therapies I've heard about, like red light therapy or lymphatic drainage massage? Do those have a place in post-surgery recovery?
They can be incredibly beneficial for some people. Red light therapy uses specific wavelengths of light to actually stimulate healing at the cellular level. Lymphatic drainage massage helps move excess fluid out of the body, reducing swelling and promoting detoxification.
Okay.
And then you have acupuncture, which can be incredibly effective for pain management and reducing inflammation.
Wow. So many options to explore. It's incredible to think that alongside conventional medical treatments, we have this whole arsenal of alternative approaches to support healing. I'm curious, of all these alternative therapies, which ones have you seen the most impressive results with in your practice?
Oh, that's a tough one.
Yeah.
Oh, that's a tough one. It's hard to pick just one, honestly.
Yeah.
Each therapy has its own unique strength and can be incredibly effective,
Right.
depending on the individual and the type of surgery.
Okay.
I've seen patients experience remarkable pain reduction with acupuncture, while others have seen dramatic improvements in swelling and range of motion
Wow.
with lymphatic drainage. And the beauty of these modalities is that they can often work synergistically with traditional medical treatments to enhance the overall healing process.
That makes so much sense.
Mm.
It's not about choosing one over the other.
Right.
It's about finding what works best for you
Exactly.
and creating a personalized recovery plan.
Mm.
But before we dive deeper into those alternative therapies,
Yay.
there's something else this source touched on that I think is so important,
Okay.
and that is self-advocacy.
Oh, yeah.
Especially after surgery, when we might be feeling vulnerable, It can be easy to just passively follow the doctor's orders without really understanding what's going on or asking questions.
Absolutely. You are your own best advocate, even or perhaps especially when
Yeah.
you're dealing with medical professionals.
So how can we be more proactive in our recovery? What does advocating for ourselves actually look like in a practical sense?
Well, it starts with being informed.
Okay.
Take the time to research your procedure. Understand the potential risks and benefits, and ask your doctor any questions you have. Yeah. Even if they seem basic or silly.
It's about being an active participant in your own healthcare, right? Not just blindly following orders.
Exactly. And don't be afraid to speak up if something doesn't feel right or if you're experiencing pain that isn't being managed effectively.
Right.
Your body better than anyone else.
That's so empowering. I think sometimes we can feel intimidated in a medical setting and hesitate to question the experts.
Yeah.
But ultimately, it's our health, and we have the right to be fully informed.
Absolutely.
And involved in our own care.
You always have the right to a second opinion.
Right.
If you're feeling unsure about anything, it's your health, and you deserve to feel confident and comfortable with the treatment plan.
Okay, so we've covered the physical aspects of recovery, the importance of self-advocacy.
Yeah.
Is there anything else we should keep in mind as we navigate this post-surgery journey? I'm thinking about the mental and emotional side of things. It can't be easy to stay positive.
Oh, absolutely.
When you're dealing with pain, discomfort, and the disruption to your daily life.
The mental and emotional impact of surgery and recovery is often overlooked.
Yeah.
But it's incredibly important.
It's that mind-body connection again, right? But how do we stay positive when our bodies are telling us to just rest and recover? It seems like a bit of a paradox.
It's all about finding ways to nurture both your physical and emotional well-being. It's not about forcing yourself to be happy all the time.
Right.
But about cultivating resilience and managing stress in healthy ways.
So what are some practical ways to do that? Where do we even begin?
Mindfulness and meditation can be incredibly helpful. Even just a few minutes a day of focused breathing can help calm your nervous system, reduce anxiety, and bring you back to the present moment.
Yeah, I've definitely found that deep breathing can work wonders when I'm feeling overwhelmed. It's like hitting the pause button on all the mental chatter.
It really is. And don't underestimate the power of connection.
Oh, yeah.
Surrounding yourself with supportive friends and family.
Yeah.
People who can listen without judgment and offer practical help can make a world of difference.
It's like having your own personal cheer squad, right?
Exactly.
People who can lift you up when you're feeling down and remind you that you're not alone.
Exactly. And don't be afraid to ask for help when you need it, whether it's with meals, errands, or just someone to talk to. People are often more than willing to lend a hand.
Yeah.
But they might not know what you need unless you tell them.
That's so true. Sometimes we just need to swallow our pride and let people support us. And I think it's also important to acknowledge that it's okay to have down days. Recovery isn't always linear.
Absolutely. There will be ups and downs, moments of frustration, and setbacks.
Right.
It's important to be kind to yourself and allow yourself to feel those emotions without judgment.
So it's not about denying the negative, but about learning to ride the waves.
Exactly.
And knowing that it's all part of the process.
Yeah. And sometimes laughter can be the best medicine.
Oh, yeah.
Don't be afraid to watch a funny movie, read a lighthearted book, or share a joke with a friend.
Yeah.
Laughter can be a powerful antidote to stress and can help shift your perspective.
That's such a good reminder. We can easily get caught up in the seriousness of recovery and forget to find moments of joy and lightness.
And speaking of finding joy, let's move on to those alternative therapies we touched on earlier.
Right.
I think you'll be fascinated by how these modalities can complement your recovery journey.
Okay.
And enhance your overall well-being. Shall we dive in?
Let's do it. I'm ready to explore these alternative therapies and see how they can supercharge the healing process. Where should we start?
Let's do it. I'm ready to explore these alternative therapies and see how they can supercharge the healing process. Where should we start?
Well, red light therapy has been generating a lot of buzz lately, and for good reason. It's a non-invasive therapy that uses specific wavelengths of red and near-infrared light to stimulate cellular processes and promote healing. I've seen those red light panels popping up everywhere, but I'll admit I'm a little skeptical. How can light actually help the body heal? It sounds a bit too good to be true.
I understand the skepticism, but there's actually a growing body of scientific evidence.
Okay.
Supporting the effectiveness of red light therapy, it works by delivering energy to the cells, which can help speed up wound healing, reduce inflammation, and even relieve pain.
So it's not just about heat.
No, it's not
Okay.
about heat at all. It's about delivering photons of light energy
Okay.
that are absorbed by the cells. This energy stimulates the mitochondria.
Okay, back up for a second. Mitochondria, remind me what those are and why they're important for healing.
Think of mitochondria as the energy factories within our cells.
Okay.
They're responsible for producing ATP, which stands for adenosine triphosphate.
Okay.
ATP is like the fuel that powers all cellular processes, including healing and repair.
So red light therapy is like giving our cells a shot of energy to boost their healing power.
Exactly. And studies have shown that red light therapy can be beneficial for a wide range of surgical recoveries.
Wow. From wound healing and scar reduction to nerve regeneration. It's pretty remarkable.
That is remarkable. Are there any side effects we should be aware of?
Red light therapy is generally considered very safe when used correctly.
Okay.
Of course, it's essential to use a device that's FDA cleared and to follow the manufacturer's instructions.
Right.
But overall, it's a very gentle and non-invasive therapy.
Okay. Good to know. So red light therapy seems like a promising option. What about lymphatic drainage massage? I've heard it can be helpful for reducing swelling, but I'm not quite sure how it works.
Lymphatic drainage is a gentle rhythmic massage technique
Okay.
that helps stimulate the lymphatic system, which is basically your body's drainage system. It helps remove waste products, toxins, and excess fluid from the tissues.
So it's kind of like giving your body's natural cleaning crew a little extra help.
Exactly. And after surgery, the lymphatic system can become sluggish, which can lead to that uncomfortable swelling and fluid buildup. Lymphatic drainage massage helps get things moving again, reducing swelling, improving circulation, and even boosting the immune system. It sounds like a win-win-win. And what about acupuncture? I've always been a little intimidated by the needles,
Yeah.
but I'm open to exploring it. What can you tell me about its role in post-surgery recovery?
Acupuncture is an ancient Chinese practice that involves inserting very thin needles into specific points on the body.
Okay.
It might sound scary, but most people find it surprisingly painless. You might feel a slight tingling or pressure, but it's generally not uncomfortable at all.
Okay, that eases my mind a bit. But how does sticking needles into your skin actually help with recovery?
Acupuncture works by stimulating the release of endorphins, which are the body's natural pain relievers. It also helps improve circulation and reduce inflammation, which are all key factors in the healing process.
So it's like a natural pain management tool that also helps boost the body's own healing mechanisms.
Exactly. And studies have shown that acupuncture can be very effective for managing post-surgical pain, reducing nausea, and even improving sleep quality.
Wow, that's really impressive.
Uh,
I'm starting to see how these alternative therapies can be powerful allies in the recovery journey.
They truly are. And the best part is that they can be integrated with conventional medical care to create a holistic and personalized approach to healing.
This has been such an eye-opening conversation. I feel like I've gained a whole new understanding of post-surgery recovery, from the science behind swelling to the power of self-advocacy and the fascinating world of alternative therapies.
It's been my pleasure. I always find it inspiring to see people taking an active role in their health and exploring all the options available to them.
Well, you've definitely inspired me to be more proactive in my own healing journey. I think we've covered so much valuable ground today, and I hope our listeners are feeling just as informed and empowered as I am.
Me too. And remember, every recovery journey is unique.
Right.
What works for one person might not work for another.
Yeah.
It's all about finding what resonates with you and creating a recovery plan that supports your individual needs.
That's such an important reminder. We're not all going to heal at the same pace or in the same way, and it's okay to ask for help and support along the way.
Absolutely. You don't have to go it alone. Reach out to your healthcare team, your loved ones, and your community for support, and never underestimate the power of your own inner strength and resilience.
Beautifully said. Thanks for joining us on this deep dive into post-surgery recovery. Until next time, stay curious, stay informed, and stay well.